everybody, to Sisterhood Super Tuesday. Michelle Sasson is a speech pathologist, language pathologist working in both an acute care hospital and a pediatric clinic. She specializes in pediatric communication, helping children with a variety of speech and language disorders. She also specializes in swallowing and stroke, helping adults rehabilitate swallowing function and communication. She obtained her bachelor's degree in cognitive science from McGill University and completed her master's degree in health science at the University of Toronto. Michelle enjoys connecting with others over shared stories and Shabbat dinners. Tonight, we are honored to have her speak to us about zooming into your voice. Go ahead.
Thanks, Grace. Hi, everyone. Thank you so much for being here. And thank you so much for having me. So today I'm going to be talking about zooming into your voice. So let's get started. Okay. So today I'm going to be talking about the role of a speech language pathologist. I'm going to be talking about how we're involved in assessing and treating speech and language disorders in young children. I'm going to be talking about our role in assessing and treating voice disorders and our role in assessing and treating swallowing and swallowing disorders. Okay, so I've separated my presentation into 3 sections or 3 chapters. So there's a little bit, there's something for everyone here. And of course, I'm going to be talking about the implications of COVID and how that can affect, how that affects our role as a speech language pathologist. So my first question to you all is, what is a speech language pathologist? So at this point, if you have an answer, please unmute yourself. And if you don't, stay muted. But I ask that once you unmute yourself, don't forget to mute yourself back again. So go ahead. What is a speech language pathologist?
Someone who helps with speech impairments, like the S's, the R's, the T's, as well as helps in the language formulation for people who need to know how to speak better or formulate their sentences.
Perfect. Thanks, Ben. That's great. Yep. Anyone else?
It's Charlie, not Ben.
Oh, you have the same voice online. Sorry.
And someone who helps people after they get sick also. If they have a stroke or they can't talk, they have to learn how to speak.
Perfect.
And maybe someone who doesn't say the R well or the T well. You have to teach him how to say S, T, R, something special, not to say wow, 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 like that. Okay?
Absolutely. You're absolutely correct.
Okay.
Okay.
If someone has trouble swallowing, very important.
Thank you. That's it. Very good. Awesome. So let's get into the scope. Don't worry, I'm not gonna speak too much about it, but as you can see here, there's a huge scope of practice for speech language pathologists. And I'm gonna start out by saying that a speech language pathologist is the same as a speech pathologist, and it's the same as a speech therapist. The 3 professions are completely synonymous, so there's no difference, okay? So why a pathologist? Pathology is the study of disorders and diseases. So we specialize in disorders related to speech and disorders related to language, okay? And as you'll see here, a lot more. So let's get started. Speech. Speech refers to the sounds in a language, okay? So if someone has trouble saying the R's, like some of you mentioned many times, that can be a speech delay or a speech disorder. We also deal with difficulties in sounds that are related to neurological disorders. So anything that has to do with a sound of a language, that's speech. Then we've got language. Language is more of the abstract sense, and it has to do with how we express ourselves, putting words together to form sentences, but also how we understand language, okay? Next, we have voice and resonance disorders, and that refers to the physical sound of our voice. Swallowing. A lot of people don't know about swallowing and feeding disorders, but typically when they're associated with old age, we're going to talk about it later, and they're associated with a health condition or a neurological condition. So patients can develop swallowing disorders. Fluency has to do with stuttering. Accent modification. For those of you who've immigrated to Canada, maybe later in your life, you've developed a heavier accent. So people who have trouble inserting themselves into society, who don't really like their accent, they will look for accent modification services. Cognitive communication. So that refers to one such example is social communication skills. So how do we know that we have to look the person we're speaking to in the eye? How do we know we have to face the person we're speaking to? How do we know that we have to wait for someone to finish speaking before we can speak? Okay, cognitive communication is a lot more than that, but that's just an example. Literacy, reading and writing. And then of course there's communication and swallowing disorders related to other issues like hearing impairments, traumatic brain injury, dementia, and so on. So today we're going to be focusing on speech and language, voice and swallowing. These are the three sections. Okay, so I'm not going to get too much into this, but how do we develop language? So there are many different schools of thought here, okay? So there's no one right answer, but I'm just going to talk a little bit about different theories. So first we've got behaviorism, and that's the idea that language is a learned behavior. So we learn language through the stimuli, through the environment, things that we hear, we imitate people. So it's truly like a behavior. I'll mention that this has largely been rejected. So not many people believe in behaviorism anymore, but it's a school of thought. Then we've got constructivism. Children learn language based on their environment and their linguistic input, but then there's also, we generalize language through learning mechanisms in our brain. Then we've got nativism or rationalism, and that's children are born with an innate predisposition to learning language. So we're born with some structure or some innate predisposition that allows us to acquire language. Okay, so there's a lot more, but essentially all the approaches agree with the model that there's some interaction between nature versus nurture. Okay, so there's an interaction between what we get in our environment and what we're innately born with, right? Our language learning mechanism, and that results in language acquisition. So the theories just differ in how much importance they place on each thing. Okay, so is there a particular time where we have to learn language? The answer is yes. There's a critical period hypothesis, and that says that children have to acquire language within a particular time frame in order to be able to acquire it at all, okay? So that's the idea that the research shows that if you want your child to develop a language and high proficiency in that language, it has to be within the first 5 years of their life. Otherwise, they might not develop adult-like proficiency skills or adult-like language. There is other research to suggest that that window closes at puberty, but still, the point is that there is a window where people have to learn a language. So we learn a lot about this critical period hypothesis through studying what we call wild children. Apologies in advance. I know this may sound a little bit graphic, but so there's a girl named Jeannie. She's one such example of wild children. She was severely abused for the first 13 years of her life. So she had no language exposure up until the age of 13. And so she learned language when she was placed in foster care. And then her language skills were studied several years after her discovery. And what they found was she never developed adult-like language. So examples of sentences that she would produce are things like, Mama, wash hair in sink, at school, scratch face, I want Curtis play piano, etc. So you might notice that, yes, she's developed a nice vocabulary and she can string words together to make sentences, but it's not proficient, it's not adult-like. So what we understand is that neglect in general causes this lack of stimulation that is needed to support the brain architecture. Those neural networks that form do not form because of neglect. We also learn about this through people who become deaf later in their life, people who have to learn American Sign Language or ASL. So what we know is that adults who learn ASL later in their childhood tend to not reach full levels of proficiency. We also learn about the effects on second language learning. If you want to learn a second language, the younger you are, the more proficient you will be at learning a second language. And what, interestingly enough, the age that you arrive into a foreign country predicts how heavy your accent will be. So for those of you who immigrated to Canada much later in your life, chances are you have a much heavier accent than those of you who immigrated earlier. Okay, so now let's talk about phonemic development, which is sound development. I'm not going to get into too much detail, but bear with me. So a phoneme is a unit of sound that distinguishes one word from another in a language. Okay, so we know the p sound, P, and the b sound are two different phonemes because pad and bad are two different words. Versus if we have something like butter and butter, the t and the d are not two different phonemes because they have the same meaning. The word means the same thing. So phonemes make up the sounds in a language, and they generally fall into two categories, consonants and vowels. And so although there are 26 letters in the English language, there's 44 phonemes, okay? So the sound sh, it is one phoneme, even though it is two letters. So now what we find is interesting is that we're actually born with the capacity to hear the difference between all the sounds in all of the world's languages, okay? And this is by 4 weeks old, so we're essentially born with it. But what we find is that later, by 6 to 12 months, we no longer react to those contrasts in languages that are not heard in our environment. So you're gonna see what I mean in just a sec. So a study was done on American infants and Japanese infants, okay, to see if they can hear the contrast between ra and la. Now, what's interesting to note is that in Japanese, there is no L sound, there's no L sound. So they do have a sound that's a cross, sort of a mishmash between R and L, but it sounds more like our English R. There's very few characteristics that are similar to the L sound. And so that's why when they pronounce the word English, it's pronounced English, okay? So in this study, around 6 to 8 months, American infants and Japanese infants did not differ in their ability to hear the difference between ra and la. But then by 10 to 12 months, by 12 months, the American infants improved in their ability to hear that contrast, and the Japanese infants declined. All right, so let's continue here. So, like I mentioned, our environment really shapes the sounds that we can hear, okay? So once we can distinguish between sounds, that's when we can start to produce them. If we cannot distinguish between sounds, we will not be able to produce them, okay? So that's why I'll take a moment quickly to highly recommend getting your child a hearing evaluation to make sure that a child can hear all the appropriate sounds. But in any case, so as you can see here, very briefly, the sounds develop at different time frames, okay? So the p sound, the m sound, the w sound, these are earlier developing sounds. So they develop even before the age of 2, and by 3, you should start to have them acquired. Versus the j sound, like this in garage, it starts developing around 6 years of age and then continues, is still developing past 8. Okay, so there's a huge range, and kids develop them at different time frames. Now, even the S sound, for example, it'll start developing at 3, and kids will still have trouble with it up until the age of 8. So this doesn't mean that you wouldn't start working on different sounds in therapy. And in fact, I would argue that it's better to work on it earlier rather than later. But it just means that that sound could still be developing up until 8 years old, for example, for the sound S. So let's keep going. Okay, so now the next couple of slides, they just highlight different developmental milestones. And I've separated it in receptive language, what we can understand, expressive, what we can produce, and our pragmatics, which is our nonverbal communication. And so I'm just going to go through one of them just so that you can get a sense. But I I recommend that if you do have a child between the ages of 0 and 5, you refer to the milestones to see if they're developing appropriately and developing the skills that they need to be able to learn language. So if your child is between the age of 1 and 2, receptively, what they should understand, they should be able to follow one-step directions with cues. So for example, if I point to their boots and say, go get your boots, the child should be able to understand that. If they should be able to understand simple questions like, where's daddy? By maybe looking around the room to look for their father. They should be able to understand a choice question. Do you want milk or juice? They should understand that they have to point or choose an object. Expressively, by 24 months, they should be able to produce 200 to 300 words. Okay, so that's quite a few words for a 2-year-old, right? Typically, the rule of thumb is if your child is 24 months old and has less than 50 words, we recommend to go start speech therapy. But if you start at 24 months and they only have 50 words, you're already behind. So I recommend to go see a therapist, at least for a consultation, much earlier. They should understand and express a yes/no question. Are you hungry? Yes or no. And pragmatically, they should be able to wave bye-bye. They should be engaging in parallel play. So if they see their friends right next to them, they should be playing right alongside them and sort of peering over their shoulder to see how the others are playing. Okay, so this is 2 to 3, 3 to 4, 4 to 5. Like I said, you can refer back to this presentation a bit later if you have a child that's within this age group. So now let's talk about a couple language stimulation strategies. So first off, face-to-face. So this is really getting down to your child's eye level so that they can see your face. And the benefits to this are, there's many, many benefits. First off, it makes your child understand that what they say holds value and that it's important, and that you're listening to them. But secondly, they learn how to produce the sounds of speech. They understand how to produce them. Observe, wait, and listen. We call this OWL. If your child is playing, it's best not to insert yourself right away, but to wait from a distance and observe what interests them. Once they interact with you, then you can respond immediately and continue to follow their lead. If they're playing with a puzzle, don't encourage them to say, hey, play with the fire trucks. Let them play with the puzzle and wait for them to include you in their play. And then you can continue to follow their lead. Next is provide a language-rich environment. So you want to include a variety of words, nouns, action words, descriptive words. If let's say it's bath time, you don't want to just say rubber ducky, water. You want to introduce words like pour, rinse, words like wet, hot, things like that. You want to use sentences that are slightly more complex than that of your child's. So I want you to just consider if you're learning a language, okay? Let's say you go to Japan and you speak a couple words of Japanese. If the native Japanese speakers start talking really, really fast, saying words that, full sentences, do you think you would catch on to what they're saying? No. So it's the same with children. They'll pick up on what you're telling them, keeping your sentences just above where they're at, just above their level. Expand. Add words or concept to what your child already says. If your child is looking out the window and says truck, you might respond, that's right, it's a big red truck. You're introducing new concepts. And finally, recast. If your child says a word or a sentence the wrong way, repeat what he has said with the right pronunciation or with the right grammar. Okay, so if your child says, the wabbit is jumping, you can say, that's right, the rabbit is jumping. So you're highlighting the sound, you're saying it slowly, you're prolonging it. The idea here is not to make them repeat it, but just to give them a model so that they understand how it's supposed to be said or pronounced. Okay, now we're on to the second chapter of voice and voice disorders. Okay, so how is voice produced? So I find this part very interesting. I hope it's not too graphic, but in any case. So when we speak, we push air through our lungs. So right here, we push air through our lungs. It travels through our trachea or our windpipe. And there it passes through the vocal cords, which sets them into vibration. From there, the vibration gets resonated through the rest of the vocal tract, and that ultimately results in the sound of our voice. Okay, so vocal cords are open during inhalation, and they are closed when we're swallowing, and they're vibrating when we're speaking. So I'd like everyone to just go ahead and put your hand on your throat or your larynx and just go and say, you should feel a vibration when you do that. And that's actually the vibration of your vocal cords. Okay, so let's talk about the factors that impact our voice. Okay, so we're going to delve into these a little bit further. So here's our anatomy. It's the way our vocal cords look. And we're going to talk about different factors that affect our voice: our lifestyle, our emotion, acid reflux, technique. Our lifestyle. So our job. So these things come, like, they interact together, and our lifestyle has a huge impact on the sound of our voice. So let's go with our job. Do you have a job that demands a lot from your voice? Are you a professional voice user? Are you a singer, an actor, a rabbi, a lawyer? Do you use your voice a lot during the day? Your general health. If you are someone who is generally active, you will and sleeps well and eats well, you will generally have a healthier voice. No surprise there. Your environment. If you work in a dry environment, in a loud environment, in a dusty environment, all these things will have an effect on your voice. Hydration. You're supposed to be drinking for your vocal health 1.5 liters of water a day, or between 8 to 10 cups. And the reason for this is because you want your vocal cords, just like any organ, to be hydrated. So when they vibrate, they're supposed to be vibrating lusciously and effortlessly, right? So if you think of like two water beds coming together, they're plump and they're lush and they're supposed to vibrate symmetrically. If you're dehydrated, not only do they not vibrate as efficiently and as symmetrically, but also they're more susceptible to injury. So if, let's say, you're out at a wedding, you don't drink at all, any water at all, and you're dehydrating yourself, well, chances are your voice is going to sound a lot more different after the wedding than it did before. Throat clearing. If you are someone that does this all the time, okay, but it's not productive, which means that nothing comes up, no mucus or phlegm comes up, that's actually hurtful and it hurts your voice. If phlegm and something comes out, that's good and that's actually necessary. But if you're constantly doing that throughout the day, you're essentially slamming your vocal cords together. And if you keep doing that, it'll start to get injured. Emotion. I'm not going to delve too much into this, but I just want people to be aware that your emotions, your stress levels can have an impact on your voice. And in fact, a sudden stressful event can actually make you lose your voice. And you might need therapy to regain it back. But all this to say, your stress and your emotions can have a huge impact on the sound of your voice. Next is acid reflux. So who knows what acid reflux is? You guys can unmute yourself, by the way. What is acid reflux?
Acid reflux is when you lie down right after eating and the acids from your stomach go up to your sinuses, basically, but they're going through your throat, and then your voice becomes hoarse and you get a headache because you get sinus congestion.
Okay, that's a good description. Thank you. So exactly right. When we have acid in our stomach that escapes your stomach, stays in the esophagus or the food tube, okay, that's essentially acid reflux. If it affects your voice, it may be spilling over onto your vocal cords, which are right here. Okay, so if you want to generally, if you're having trouble with your voice, you want to avoid acid reflux and prevent it. So you want to avoid things like chocolate. You want to avoid things like coffee or caffeine. Now, I know this one is a tricky one, and I'm not going to say to people, do not have coffee, do not have caffeine. That would be criminal. I would just say, limit it to 1 to 2 cups a day. If you're someone that's drinking 8 cups of coffee a day, well, my recommendation would be different. Carbonated drinks, high fat or oily foods, cream, tomato-based products, citrus juices, spicy food, and mint. For those of you that like chewing mint gum and you have acid reflux, the mint is not helping. Like our friend just mentioned, if you lie down within 3 hours of eating, then chances are the acid from your stomach is coming right back up. And that's not good for your voice in any way. So you really want to, between the time from your last meal to the time where you want to go to bed, you want to make sure that that's at least 3 hours long so that it gives you time to digest before you go ahead and lie down. Sleeping position. So if you are, when you're lying down, the acid does it, like our friend mentioned before, it does go back up. So what I do recommend is using something like a wedge pillow, which is right, I don't know if you guys can see that well. So a wedge pillow or raising the head of your bed by about 6 inches, that'll help to keep the acid down. Smoking or alcohol. These two things, what they do, this is the door to your stomach right here. They make this door loose, basically allowing for the acid to escape your stomach into your esophagus. Okay, so if this door is loose, the acid will go back up. So these are 2 things to avoid if you have reflux. Being overweight, wearing tight clothes. If you're someone who wears a tight belt, or if you're someone who wears Spanx all the time, you're squeezing your abdomen, basically squeezing all the acid back up. And certain medications. So this is for your general knowledge. Things like arthritis medications, sedatives, calcium channel blockers, these things will also promote reflux. If obviously you take the recommendation as your doctor says, but just so you know, it may affect your voice as well. Finally, your technique. If you are someone who's generally very loud, this can be harmful for your voice, especially if you're speaking loudly all day. So what you're doing, you're basically pushing more air through your vocal cords, setting them into a more rigorous vibration. And if you do that prolonged, if you do that throughout the day, you can bet that your voice is going to be tired. If you speak too much, generally you want to budget your voice during the day. If you know that you're going to be in meetings back to back all morning, make sure to set time aside later for the day to just recuperate. Tension. So just like any other muscle, if you hold tension in your back and your shoulders, that can also affect your voice. Now I want to just do a quick little experiment here just to see, why not? I'd like everyone to touch under your chin and touch this muscle here. I'd like you to, this is your base of tongue, okay, right under here. I want you to tell me, is it soft or is it hard? Feel free to unmute yourself.
Soft.
Soft.
Good. Anyone?
Soft.
Sorry?
Soft for old people, hard for young people, soft for old people.
Okay. If anyone has a hard base of tongue, that just may suggest that you are holding tension in your base of the tongue, in your base of tongue. So what I suggest, if it is hard, to just knead it a little bit. You want to massage it, bring it forward. So you're just basically massaging your tongue if you hold any tension there. Also, bite down. Feel your muscle, your jaw muscle. This is your masseter muscle. Go ahead and massage that. Okay. And then you can go anteriorly and go under your cheekbones. These are all muscles where you may be holding tension. So if it feels sort of tender, you want to make sure to massage these muscles. Same with your shoulders. Okay, you can just go ahead and massage your shoulders. So also breath holding. How many of you get told by your Apple Watch, don't forget to breathe? I'm sure many of you, I get that all the time. You want to allow your breath to flow so that you're not keeping your vocal cords shut in a tense position. Same with hard voice onset. If you're someone who talks a lot like this, you're basically slamming your vocal cords together, and that is also abusive to your voice. Okay, so hold on. So how common are voice disorders? So the prevalence is between 3 to 10% in the general population, and they're more frequent in the older population. So if you're 45 to 64 years old, you have a higher chance of developing a voice disorders. And unfortunately for men, it's more common in men than in women. Okay, so one of the most common vocal pathologies is vocal nodules. Again, I'm sorry if this is graphic, sorry in advance. But so these are your vocal cords, and you're sort of getting a bird's eye view. So you're looking on top of them. So this is the most common benign lesion, or one of the most common, and they can be acute, which means they come and they go, or it can be chronic and it lasts for a long period of time. They're usually bilateral, which means that it's on both vocal cords. So it's sort of like you're clapping your hands together. You can think of it that way. That can develop into a nodule. So it's related to traumatic or hyperfunctional voice use. So if you're someone who speaks a lot, who speaks loudly, and you basically do all of what we just spoke about, you can develop vocal nodules. And so what this does, these are basically like blisters. So let's talk about acute vocal nodules. They're like blisters. So, you know, if you're shoveling all day, or if you're wearing high heels to a wedding, after that night, you can develop blisters, right? So, so eventually those blisters will go away when you stop engaging in abusive behaviors, right? But if you keep wearing high heels, what happens is it becomes callous, right? The open wounds, you keep abusing it, it becomes callous. And so what happens is your vocal cords will vibrate, but they're more stiff. So they don't vibrate as lusciously and as symmetrically. So your voice will sound sort of like this. It'll sound rough because it's not vibrating symmetrically. It'll sound breathy because you have air escaping through them, since they're not having nice contact across all the edges of the vocal cord. So what happens here is, if you continue doing that, typically if you're starting to develop nodules, you're gonna push harder on your voice just to make sure that your voice sounds like it did before. But in doing that, you can develop muscle tension because you're working so hard to maintain the sound of your voice. And so a simple treatment is voice therapy. Simple, I shouldn't say simple. But so what I like to do, if you do have muscle tension, just a nice little hum. And what you're doing, you're basically relieving the tension from your larynx and pushing it to the front of your face. Okay, so you should feel vibration at your lips when you do that. Another common vocal pathology is presbylaryngis. So who here has noticed any changes in their voice from when they were younger? You can unmute yourself if you've noticed any changes.
And deeper. My voice is deeper.
Your voice is deeper? Okay. Anyone else?
I have the acid reflux voice where I'm hoarse all the time.
Okay.
And
So
even though I'm now paying attention and not getting headaches and not getting, but I still have like a burn in my throat.
okay.
Doesn't go away.
Okay. What I want to say though, quickly, because you reminded me, is that if just because you don't have heartburn, it doesn't mean that you don't have reflux. You can have something called silent reflux. So just because you're not feeling any heartburn and that pain in your chest doesn't mean that you don't have reflux. So you reminded me. But so what presbylaryngitis is age-related changes in your voice. Okay, so you can have decreased respiratory efficiency. That means you're not passing air through your voice as efficiently as you used to. It may be you reduced elasticity, so they're not as elastic, they're not as flexible as they used to be. And overall, you lose tone, right? So as you get older, the muscle underlying your vocal cords will sort of wither away and will atrophy. And so that'll cause this sort of bowed opening or closure when you go and close your voice. And so that's because of the atrophying under, but also there's all the muscles in your voice will start to wither away. So that'll affect really how you sound. So let's go into the characteristics quickly. It'll cause decreased loudness. You might notice that your voice is not as loud as it used to be. You might have instability in your pitch. So you might have voice cracks more often. You might, like I said, you might have differences in your loudness. Your pitch drop, like someone mentioned, your voice might be lower. And basically the quality of your voice generally decreases. And that is because of this bowing that we tend to see. And so bowing just means that your vocal cords are not vibrating. You're not getting the full contact that you need when your vocal cords are vibrating. And so what's nice is that with voice therapy, you can regain that strength in your muscles and you can regain your voice. So I thought that would be interesting to share if you're not happy now with your voice and you want to change.
I'd like to add on that because you asked about has your voice changed, and I noticed, for instance, that like I would call Videotron pretending to be my father on his behalf, and so to match an older voice, I would actually have to, I don't know, it's exactly what you described. I would say, hello, I am Sam Fatale, and I would, you know, I'd kind of decrease the quality and smoothness of the sound to age myself 40 years.
So there you go. So I'm happy that you have firsthand experience with this. But what's nice is, like I said, if you work on your voice, you can regain those muscles just like any other muscle, right? Okay, so the take-home message here: be kind to your voice. Hydrate. Drink a lot of water throughout the day, 8 to 10 cups. Avoid unnecessary throat clearing. And I'm going to stress again, if you're throat clearing because it's productive, because you have phlegm or mucus, that's necessary. You need to get that mucus out of your lungs. But if you're someone who does it very, very often, keep in mind it can have an effect on your voice and it's damaging to your vocal cords. Avoid speaking loudly for long periods of time. Budget your voice throughout the day. If you know you're going to be speaking nonstop, make sure to set time aside where you're not speaking. Avoid acid reflux. Everything that we spoke about for the reflux, you want to implement that. Reduce your tension, you know, go in, massage your base of tongue, your masseter, your temporalis. You want to massage and reduce tension. And then stress regulation, if you can manage your stress. All right, last chapter. Hope everyone is still awake. Swallowing and swallowing disorders. When you have a swallowing disorder, it is called dysphagia. So let's talk about that a little bit. Dysphagia refers to any difficulty that you might have moving food or liquid from your mouth to your stomach, okay? Occasional difficulties usually isn't a cause for concern, usually related to not chewing your food properly, you know, eating big bites. But if you have persistent difficulties, that can be an indication of a medical condition. Okay, so I want to open this video quickly. All right, so this is basically an x-ray, a moving x-ray of someone swallowing. So I want you to notice, here is the esophagus here is your trachea. We do not want things going into this side. So this is what swallowing, typical swallowing looks like. Beautiful. Okay, so you see nothing went into the trachea. It was a nice series of coordinated events. Now let's go to abnormal swallowing, what it may look like. Keep in mind, this is a very severe case. It really should not happen, but take a look. Okay, so you notice went into the windpipe, into the lungs. Right below this windpipe, you have the lungs. So all of this liquid that this person is ingesting is going into their lungs. And there's that. Okay. All right. Here we go. Okay, so what you can appreciate right off the bat is that swallowing is absolutely a series of coordinated events that almost occur instantaneously. You have to have immense precision. Your muscles have to basically work together at a rate that's extremely, extremely fast. And most of us don't even think about it, right? I mean, I would hope not anyways, but until you have a problem. So risk factors of dysphagia. Aging, unfortunately, the older adults are at a higher risk of swallowing difficulties, but it is not considered a normal sign of aging. Usually when you're older, you also develop other health or neurological conditions, things like stroke, head and neck cancer, head injury, Parkinson's disease, dementia, and COVID-19. We're going to talk about that later. But so if these are risk factors of dysphagia, but it is not considered a normal sign of aging. Signs and symptoms of dysphagia. If you eat and drink and you cough often or you choke, that could be a sign. If you have a wet or gurgly voice while you're eating or drinking, if you throat clear when you're eating or drinking, these can all be signs of dysphagia. If you have food that comes back up and sometimes that goes through your nose, if you have a sensation of food getting stuck in your throat or in your chest, and persistent drooling. So if you have any of these signs, or if you notice anyone who does often do these things while they're eating, it could be a sign of dysphagia. Complications. Complications of dysphagia, if you cough or you choke when food goes down the wrong way. So that can happen often. You often cough, you choke. It's a natural response. If the food or the drink, if it gets aspirated, which means if it goes into the lungs, the problem is that you can develop an pneumonia. You can develop an infection in your lungs due to the food or liquid. And what we find too often is that if you're someone who often coughs or chokes when food goes down the wrong way, you might develop a fear, right? And so that may cause malnutrition and dehydration because you're avoiding coughing on your food. So treatment. So I'm going to speak about this briefly because it really depends on the cause and the type of dysphagia. So a lot of the times clinically in the hospital, the one treatment that we do is changing the consistency of food. So I want you to think when you're drinking water, water is very fluid, right? So it just rushes quickly to the back of your throat. Versus if you have something like a honey type consistency, it's very slow moving. So something like a honey type consistency, it gives your muscles more time to react and initiate the swallow. Versus water, it goes quickly to the back of the throat. You have no time to coordinate your muscles. Okay, so this is a very common treatment. If we can identify which muscle is weaker or which muscle is impaired, then we would do muscle strength training or swallowing maneuvers. So like I said, if let's say your base of tongue is weak, we would work on the tongue to make sure to strengthen it. If your pharyngeal wall is weak, we would work on developing the pharyngeal wall, and there's many exercises that we can implement. Postural adjustment, very important to sit at 90 degrees all the time when you're eating. Never lay back like that. A chin tuck. So this is typically very helpful. What you're doing here, when you're putting your chin towards your chest, you're squeezing your vocal cords together and you're helping them close and keep them shut. So, and you're also opening up a pocket that exists in your throat to catch any food or liquid that might go into your lungs. So this is a protective measure as well. Controlled intake. If you control the rate, eat slowly, small bites, and so on. And then I'm going to highlight oral hygiene here. And as Dr. Lisa Katan mentioned in the previous lecture, if you attended, very important to have good oral hygiene. Make sure to brush twice a day, floss, and so on. The reason for this is because everyone has cultures of bacteria in their mouth, okay? Even if you don't have teeth, it's still very important to brush your mouth, because if there's a chance that this material goes into your lungs, you're also taking all the bacteria with it. And so that can develop a pneumonia and a chest infection. So very important, oral hygiene. Take-home messages. During a meal, always sit at 90 degrees. Avoid talking during a meal, right? Because you're not really focused on swallowing. Your muscles are focusing on talking to the person next to you. Take small bites or sips. Eat slowly. Diligent oral care. Brush your teeth. Take note of the frequency of coughing. How often when you're eating do you start coughing and have coughing episodes? Also take note of what foods you're coughing with. Are there any particular textures or consistencies that make you cough? Lastly, the implications of COVID-19 on speech-language pathology. So since the pandemic, we've seen children regress in their communicative function. I've seen kids that have acquired certain goals that we've set out for them, but then once the daycares opened, once they were able to get back, they were not as communicative, they were reserved, they were not talking as much. And it's so important for kids to be around their peers, to be around other children, so they learn these nonverbal skills, not only verbal, right? They learn language from their peers, but also that nonverbal communication. So we've seen that regress. 40 to 60% of COVID patients who've been on a mechanical ventilator for a long period of time experience dysphagia afterwards. Dysphagia can occur after 48 hours of intubation, but the likelihood increases the longer you're intubated, around 5 to 10 days. COVID patients may have muscular weakness related to being ill, and that can affect their swallowing. And lastly, intubation can cause trauma to your larynx or your vocal cords. It can cause swelling, paralysis, weakness, and that can also affect your swallowing. It's not just the sound of your voice. The voice is one measure that actually protects you from ingesting anything and from going into your lungs. Your vocal cords slam shut when you swallow. So if they're slamming shut, but you have an opening in your vocal cords, well, that protective measure is no longer protecting you, right? There are other mechanisms in place to protect you, to make sure that the material doesn't enter your lungs, but your voice is very important. So take care of your voice. And so all this to say, stay safe. We don't want any incidents of COVID-19. Thank you for listening, everyone. Do you have any questions?
We're proud of you, Michelle.
Bravo!
Thank
We
you.
are very proud of you.
Well done.
Thank you,
Well
everyone.
That was
done.
very informative. I learned a lot.
Good.
Yes, we love it. At
Good.
least we see each other. The family sees each other. Long time no see, Solomon.
Hello.
Hi.
Oh.
This is Gladys. Good. Bravo. And this is Evelyn. Oh my gosh.
Yeah.
Bravo, Michelle. I
Thank
didn't
you.
know you were so educated. I didn't know you were like that. I thought you are the little Michelle that I used to come to Theta and all small. I'm very proud.
Thank you.
Yes,
Thank
you
you.
I have a question for you.
You should.
Very
Michelle,
nice
if somebody
presentation.
needs things that they need a speech therapist,
Hi,
do they need
Michelle,
the
I have a
doctor to refer
question.
them?
Hold on a sec. One question.
Do I need a referral for a speech therapist, or do I just call one?
It depends for what. So if it's for swallowing, typically it's through the hospital. So you'll probably have to get a referral through your doctor. I don't know any therapists that do swallowing privately. If it's through, you can get access to speech therapists through your child's school, through the daycare as well, but you can also access it privately. You do not need a referral from your doctor.
Do I just look it up on Google?
You can look it up. You can also speak to me later. I can refer if you're interested, but you can go to our order. So there's an order of speech pathologists and audiologists. You can write it down. It's OOAQ. You'll have an access to all the speech pathologists that are licensed.
Andre Haim has a question. Go ahead, Andre.
Thank you.
Yeah. Yes, as a teacher, I used to lose my voice twice a year. Every year, I used to lose my voice. So what happens when you lose your voice?
It's a good question. So if the voice is completely gone, was your voice completely
Yes.
gone? So I can't.
Yes.
Okay. So I can't say for sure exactly why. The only way we know for sure is really just going through your nose and looking through at your vocal cords to see. But if you completely lose your voice, it could be because your vocal cords are not closing properly and they're not vibrating properly. So what you have is your lungs, which are right underneath your vocal cords, they're passing air through, but your vocal cords are not able to meet and reach contact. So if your vocal cords can't vibrate, there's no sound that comes out. And that could be for many reasons. It could be because you have a lesion or an injury on your vocal cord. It could be because the muscles around your vocal cords are very, very tense. So it's basically preventing your vocal cords from vibrating. But ultimately, if there's no contact between your vocal cords, you will have no voice. Does that answer your question?
Yeah. Thank you.
Next question, Lily Dengur.
I used to think it's a cold.
Great presentation.
It could be a
Michelle.
cold. Thank you.
Great presentation. I want to ask you, what is the difference between lisping and stuttering? And is there a remedy for this condition?
Absolutely. So a lisp is a speech delay or a speech disorder. So there's a bunch of different types of lisp.
Barbara.
Let's mute our friend Barbara. So it could be a frontal lisp, the snake. It can be a lateral lisp, a snake, where the air escapes from both sides of the tongue. The lisp is a speech issue or a speech difficulty, whereas the stuttering is a fluency disorder. So they're completely separate and the treatment is separate for both. The speech one, you would have to manipulate the tongue to show the child or the person how to use their tongue properly, whereas the stuttering is a completely different, it's a completely different treatment. And it'll depend on how old the person is and so on. But I'll just say that stuttering, there's a huge hereditary predisposition to it. So if you have a family member that stutters, the chances of you having a child that stutters is a lot higher.
Thank you.
No
I
problem.
have a question from the chat. Is vocal nodule related to a thyroid nodule?
It's different. So a vocal nodule is like a blister that develops on your vocal cords. Whereas if it's on your thyroid, it would be on your thyroid, but it would be, it's different.
Thank you. And the same person is asking, if someone sleeps on your back with mouth open, does this affect vocal cords or throat? What can be done to treat?
If you sleep on your back, let me see. If you sleep on your back, what was the question? Sorry.
With your mouth open.
Yeah.
Does this increase affect vocal cords or throat?
No, but so it could in a way, because what you're doing, you're breathing the air from your environment and it's touching your vocal cords, as opposed to if you breathe through your nose filters the air, it humidifies the air, so it's less harmful on your voice. But I wouldn't say that if that's your only difficulty, breathing with your mouth open, that you would get vocal nodules. It really has to be a traumatic behavior that slams them together. But it's better to breathe through your nose if you can, but I know there's a lot of conditions that force people to sleep with their mouth open.
Andre Sasson has a question.
What about snoring? Is there any relation?
So yeah, so snoring is when your velum, which is, so I want a, I would like a, let me connect to my presentation again. Okay. When you snore, so
not me, I don't snore, somebody else.
Okay, no problem. But so your velum, which is the soft part of your palate, is sort of vibrating to the back of your throat. So it's not really related, but it's just the vibration of the back of your soft palate.
How do you cure it?
Well, I mean, I wouldn't be the best person to answer that, but there's a lot of different measures. You have the CPAP machine that you put that allows more air to travel if you're not getting enough air. But I wouldn't be the best person to answer how to cure snoring.
Okay. Thank you, Michelle.
My pleasure.
Any other questions?
I have a question.
Go ahead, Danny.
Michelle, what is the difference in the anatomy of someone's throat or voice or trachea, whatever it is, between someone who has a good voice, like a singing voice, and someone who doesn't?
It's a good question. So it purely depends on your anatomy, okay? So like I mentioned at the very beginning, you have air that pushes through your lungs, goes up your trachea, and makes your vocal cords vibrate. Not everyone's vocal cords look the same. Not everyone's vocal tract is the same, okay? So it depends on a bunch of different factors. And people who know how to sing, yes, if they're naturally good singers, it's because their vocal cord and their anatomy is set up so that it sounds pleasant. But it could also be because they train a lot. So it depends on the anatomy of different people, right? Men have longer vocal cords, women have shorter vocal cords. So it really depends on how you were structured.
Interesting.
Michelle, did you talk about Zoom and how it affects our voice?
I didn't, because my presentation was very long already. But essentially, if you're pushing your voice and you're not getting, people tend to speak a lot louder because they think the person across the end can't hear them properly. Or if you're over the phone, you're not getting those facial cues to send the message that you're trying to send faster. And so you're pushing harder on your vocal cords, you're pushing those muscles. And so eventually your voice gets tired. And so you have to just incorporate that into your day to either massage yourself a little, take a voice break, try and speak a little bit lower, drink a lot of water, things like that.
Beautiful. Bravo, Michelle. Bravo, Michelle.
Thank you, Michelle. On that note, the Sisterhood of the Spanish and Portuguese thanks you for a beautiful evening. We learned so much. I'm sure people will have to watch the video to retain a lot more because there was a lot of information. So again, thank you on behalf of the Spanish and Portuguese as well. We thank all the participants. Questions were amazing. You're all welcome.
This is Rita.
Clap.
I just want to say something.
Go ahead.
What you're doing, Grace, is truly amazing. Getting all these young people and showing them off, it's fantastic. But for me tonight, this young girl was my teacher, my student, and now I am listening to her and learning from her. So how amazing is that? Michel, je suis tellement fière de toi. Vraiment, je t'adore.
Merci.
Vraiment. It was amazing.
Thank you so much.
Jill, you have another question in the
You are
chat.
a good teacher. You're a good teacher. You had good students.
Yeah. Depends on the kids sometimes.
Is it Rita? Which teacher?
Yes, it's Rita.
It's Rita.
Thank you so much. I have to thank the office staff of the Spanish, Françoise Babulot, Viola Tolchinsky, and Linda Booty for their unwavering support. I thank all of you for being here, and please unmute yourself and congratulate Michelle on your own.
Mazal tov.
Mazel
It's amazing.
Thank you. Thank you.
Very informative.
Hope to see each other. Hope to see
Thank
each
you
other
very much.
again.
Inshallah.
And
Beautiful.
Next week we have Dr.
We're starting the vaccines.
Next week, Dr.
Thursday.
About pain management. So please tune in next Tuesday. And
Okay. Thank you.
Thank you.
Thank you so much.
For a beautiful
Bye-bye.
evening.
Beautiful evening. Thank you very much, Grace. Thank you,
Thank you.
Michelle. Thank you.
Thank you.
Thank you guys.
Michelle.
Good job.
Thank you.
Bye.
Bye.
Bye. Mulkelmente. Bye.
Michelle, I see
Yeah.
a question that was just posted on the chat, and it's actually an interesting one from Albert. What causes a voice change upon puberty?
Okay, so
I was going to say it. Oui. And I was
that in the chat.
I was going to
Interested
ask
to
it.
know the answer.
very good question, Albert. So there's, first of all, the anatomy changes, right? So if your anatomy changes, you have changes in your voice. But what's important here is also your hormonal changes. So your hormones also have an effect on the sound of your voice. Okay, so a lot the men, they have a influx of testosterone that will inherently lower the pitch of your voice.
Très bien.
Thank you.
Yalla, bravo, Michel.
All right.
Elles ont grandi. Je dois elles ont grandi. Elles ont grandi. Proud of you. Proud of you. Okay. Good
All
night,
right.
everybody.
Bye, chérie.
Bye.
Bye night. Bonne nuit.
Bye.
Bonne nuit.
Thank you, Michelle.
Bye, Michelle.
Thank you.
Thanks, Michelle.
Thank you.
Good job, Michelle.
Thank you,
guys.
Michelle.
Very good job.
Great job.
Thank you.